1. Urgent weight loss jab warning. Common mistake can lead to organ failure. 2. GLP-1 medicines and pancreatitis risk. New genetic study uncovers the truth. 3. The deadly side effect of weight loss drugs, uncovering the truth. 4. Urgent Mounjaro warning. Avoid deadly organ damage with this vital blood test. 1. Urgent weight loss jab warning. Common mistake can lead to organ failure. A shocking warning has been issued to the 1.5 million people in the UK using weight loss injections, as experts reveal a common mistake that could put them at risk of life-threatening organ failure. But here's where it gets controversial. Many of these individuals are using these jabs without undergoing crucial blood tests that could identify potential health risks. Dubbed the King Kong of slimming injections, Mounjaro is being hailed as a game-changer for weight loss and managing type 2 diabetes, but experts warn that it is not a silver bullet and can cause serious side effects. Rachel Joy, a nurse and chief clinical officer at private healthcare provider Shemd, is sounding the alarm, stating that mandatory blood screening is essential to ensure safe use of these injections. Simple blood tests can reveal hidden health issues, such as liver problems, uncontrolled diabetes, or high levels of triglycerides, a type of fat in the blood that can increase the risk of pancreatitis. If left undiagnosed, these conditions can lead to severe complications, including organ failure and even death. Pancreatitis, an inflammation of the pancreas, is a particularly concerning risk, with symptoms including severe stomach pain radiating to the back. The UK's medicines regulator is investigating over 560 reports of pancreatitis linked to GLP-1 drugs like Ozempic, Mounjaro, and Wegovy, including 10 fatalities. Dr. Alison Cave, the MHRA's chief safety officer, notes that genetic testing could prevent almost a third of side effects. With adverse drug reactions costing the NHS an estimated £2.2 billion annually, experts are calling for stricter safety guidelines and mandatory blood tests before prescribing these jabs. But is this a reasonable expectation, or an unnecessary precaution? We want to hear from you. Do you think healthcare providers should be required to conduct blood tests before administering weight loss injections? Share your thoughts in the comments. 2. GLP-1 medicines and pancreatitis risk. New genetic study uncovers the truth. Imagine a world where a simple genetic test could save you from a painful, potentially life-threatening side effect of a medication, yet, this possibility is only now being explored. The connection between GLP-1 medicines and pancreatitis is raising eyebrows, and researchers are diving deep into your DNA to uncover the truth. But here's where it gets intriguing. Could your genes be the hidden key to safer treatments? Or is this just another overhyped promise in the world of personalized medicine? Let's unpack this groundbreaking investigation and why it matters to you. The Medicines and Healthcare Products Regulatory Agency, MHRA, in the UK, in collaboration with Genomics England, is launching a fascinating study to explore whether your genetic makeup could increase your risk of developing acute pancreatitis, a severe inflammation of the pancreas, when using glucagon-like peptide-1 (GLP-1) receptor agonists. These medications, such as Ozempic and Wegovy, are widely celebrated for managing diabetes and aiding weight loss, but they come with a catch. A small but significant number of patients experience serious side effects. To get to the bottom of this, the MHRA is calling on patients who've been hospitalized for acute pancreatitis after taking these drugs to report their experiences via the Yellow Card scheme, a system designed to track adverse drug reactions. And this is the part most people miss. Healthcare professionals are also being urged to step up and submit Yellow Card reports on behalf of their patients. Why does this matter? Because every report fuels the research, helping scientists identify patterns and potentially save lives. If you're a patient over 18 who's reported pancreatitis, As a side effect of GLP-1 medicines, the MHRA might reach out to invite you to join their Yellow Card Biobank study. Participation is straightforward. You'll provide additional details about your experience and send in a saliva sample from the comfort of your home. This sample will allow researchers to analyze your DNA and determine if certain genetic markers make you more vulnerable to this dangerous side effect. Professor Matt Brown, the Chief Scientific Officer at Genomics England, is optimistic about the potential impact of this research. He points out that GLP-1 medicines have been in the spotlight for their transformative benefits, but the risk of severe side effects cannot be ignored. Many adverse reactions may have a genetic root, he explains, and by understanding these, we could pave the way for safer, more tailored treatments. Imagine a future where your doctor could run a quick genetic test before prescribing a medication, ensuring it's safe for *U* specifically. This vision aligns with a broader shift toward prevention-focused healthcare, where the goal is to stop problems before they start, rather than just treating them after the fact. But here's where it gets controversial. Not everyone agrees that genetic testing is the silver bullet it's made out to be. Dr. Alison Cave, MHRA's Chief Safety Officer, highlights a compelling statistic: nearly 1 in 3 adverse drug reactions could be avoided if genetic testing were widely adopted. She also notes that the financial burden of these reactions is staggering, costing the NHS over £2.2 billion annually in hospital stays alone. Yet, some experts argue that the science of pharmacogenomics, the study of how genes affect drug responses, is still in its infancy. Could this focus on genetics distract from other, more immediate ways to improve patient safety, like better monitoring or education? What do you think? Should we pour resources into genetic research, or are there more pressing priorities? This investigation into GLP-1 medicines is actually the second of its kind by the Yellow Card Biobank. Earlier in 2024, the program began recruiting patients who suffered severe bleeding while on direct oral anticoagulants, showing that this approach could be applied to a wide range of medications. Each study brings us closer to a future where treatments are customized to your unique biology, but it also raises questions about accessibility. Will these advancements be affordable for everyone, or only for those who can pay? Meanwhile, the urgency of this issue is underscored by a parallel call to action from researchers at King's College London and the University of East Anglia. They are urging healthcare providers to stay alert for signs of acute pancreatitis in patients using GLP-1 receptor agonists. Severe abdominal pain, for instance, could be a red flag for pancreatitis or related conditions like biliary disease. To help doctors manage these risks, the researchers have published practical guidance in the journal *Obesity Facts*, offering tips for primary care providers. For example, they recommend routinely asking patients if they are using GLP-1 medicines, whether prescribed by the NHS or purchased privately, and adjusting doses of other drugs, like insulin or blood pressure medications, to prevent complications such as low blood sugar or dizziness due to rapid weight loss. Dr. Lawrence Dobby, a lead researcher and general practice expert at King's College London, emphasizes the importance of this guidance. I've encountered patients who are clearly using these medications, but haven't received the comprehensive care they need, he says. Our goal is to equip GPS with the knowledge to prioritize safety and clarify the risks, making these treatments as safe as possible. This advice is the first step from the Obesity Management Collaborative UK, OMC UK, a new network launched in 2024 to support clinicians in caring for patients with obesity. Professor Barbara McGowan, chair of OMC UK, adds, by integrating these recommendations into everyday practice, we can enhance patient safety and improve outcomes for those living with obesity. So, where does this leave us? The investigation into GLP-1 medicines and pancreatitis is a bold step toward personalized medicine, but it's not without its challenges and controversies. What's your take? Do you believe genetic testing will revolutionize healthcare, or is it an expensive distraction from more practical solutions? And if you or someone you know has experienced side effects from these medications, would you consider joining the Yellow Card Biobank study to help shape the future of medicine? Share your thoughts in the comments below. Let's get the conversation started. 3. The deadly side effect of weight loss drugs, uncovering the truth. The remarkable rise of GLP-1 drugs like Ozempic and Wegovy has undeniably transformed the landscape of weight management, offering hope to millions struggling with obesity. However, alongside the celebrated success stories, a concerning shadow has emerged, a potentially life-threatening side effect that's now prompting serious scrutiny. While many users experience less severe, albeit unpleasant, issues like gastrointestinal discomfort, tooth decay, or even a droopy face, a far more alarming complication is coming to light. But here's where it gets controversial. A UK regulator is now investigating a link between these popular weight loss medications and severe pancreatic problems, including a potentially fatal condition called acute pancreatitis. The Medicines and Healthcare Products Regulatory Agency, MHRA, in the UK, has received nearly 400 reports of serious pancreatic issues from individuals using GLP-1 drugs. To understand the gravity of this, acute pancreatitis is a sudden and intensely painful inflammation of the pancreas, often requiring hospitalization. While many cases are manageable, it can rapidly escalate, leading to severe complications and, tragically, death. In the UK, at least 10 deaths have already been attributed to this condition in individuals taking GLP-1 medications. Drug information leaflets typically state that pancreatitis is an uncommon side effect, affecting roughly 1 in 100 users. However, the severity of the condition warrants a deeper look. The MHRA has suggested that genetic factors might play a role, hinting at the possibility of future genetic screening to mitigate risk. This is a complex area, as individual responses to medication can vary significantly based on genetic predispositions and other health factors. Pharmaceutical companies are responding to these concerns. Lilly, the maker of Mounjaro, emphasized their commitment to patient safety, stating they actively monitor, evaluate, and report safety information. Novo Nordisk, which produces Ozempic and Wegovy, echoed this sentiment, highlighting their ongoing data collection and collaboration with regulatory bodies. They reiterated that the benefits of their GLP-1 medications generally outweigh the risks, and they encourage patients to use these drugs only under the strict guidance of a healthcare professional. And this is the part most people miss. While the UK is leading the investigation, this isn't solely a European issue. A case study in the US documented a 36-year-old woman who developed acute pancreatitis within just 5 weeks of starting semaglutide therapy. Furthermore, a larger study involving over 1,200 hospitalized pancreatitis cases revealed that patients exposed to GLP-1 receptor agonists, GLP-1 RAS, in the preceding 30 days were more than twice as likely to develop the condition. A recent 2024 analysis of over 6,751 reports between 2005 and 2023 further reinforces this connection. Although U.S. regulators, like the Food and Drug Administration, FDA, haven't launched a formal investigation, they do mandate that all GLP-1 drugs carry warnings about the potential for acute pancreatitis and are actively monitoring for this adverse effect. It's important to remember that these medications are powerful tools, but like all medications, they carry potential risks. ***, what do you think? ***, are you surprised by these findings, given the widespread popularity of GLP-1 drugs? Do you believe genetic screening should be mandatory before prescribing these medications? Share your thoughts and experiences in the comments below. Let's foster a constructive discussion about this important health issue. Perhaps you've experienced similar side effects, or know someone who has. It's crucial to share information and support each other as we navigate these evolving health landscapes. Could it be that the current understanding of the benefit-risk profile of these drugs needs to be reevaluated in light of this new data? 4. Urgent Mounjaro warning. Avoid deadly organ damage with this vital blood test. *** critical alert regarding Mounjaro. A common oversight could endanger patients' lives. A nurse has raised an alarming concern that many individuals utilizing the weight loss injection Mounjaro may be at risk of severe organ damage due to a crucial test that general practitioners, GPS, are neglecting to perform. Often referred to as the King Kong of weight loss injections, Mounjaro is now available for prescription through NHS GPS as part of efforts to combat the escalating obesity epidemic. However, these injections are not without their risks. They can lead to side effects such as extreme dehydration, nausea, and even life-threatening pancreatitis. Health experts assert that these serious complications could potentially be avoided with a straightforward blood test. Rachel Joy, a nurse and the chief clinical officer at SHEMD, a private healthcare provider, emphasized, the safest approach for individuals using these injections is to implement mandatory blood screening. She elaborated, stating, these blood tests are essential for detecting any underlying health conditions that need to be addressed before a patient embarks on the treatment plan, or to determine if the treatment is entirely inappropriate for them. Blood tests can assess liver function, thyroid issues, uncontrolled prediabetes, and elevated levels of harmful fats known as triglycerides in the bloodstream. These lipids are derived from various foods, including butter, oils, and other fats. While a certain amount of these fats is necessary for maintaining good health, excessive levels can increase the risk of heart disease. Ms. Joy cautioned, individuals with significantly high triglycerides may face a heightened risk of developing pancreatitis. Pancreatitis refers to the inflammation of the pancreas, a gland situated behind the stomach that plays a vital role in digestion and blood sugar regulation. Although the survival rate for this condition is generally high, it can lead to organ failure, which can be fatal. In severe cases of acute pancreatitis, the pancreas may lose its blood supply and undergo necrosis, potentially resulting in deadly sepsis, a severe blood infection that can cause other major organs to fail. Additionally, severe acute pancreatitis can trigger a systemic inflammatory response, leading to the failure of other organs, such as the lungs and kidneys. Ms. Joy further noted, individuals with uncontrolled diabetes are also at a greater risk of experiencing severe dehydration, which can be extremely serious. Without a blood test, this risk could easily be overlooked. Authorities are currently investigating whether users of the injection who develop pancreatitis possess a genetic predisposition that increases their likelihood of experiencing side effects. Ms. Joy mentioned that this could also be identified through a simple blood test. Sometimes these issues are subtle, yet they can have a profound impact. We need to prioritize these patients and treat obesity as we would any other clinical health condition, she stated. She is now advocating for healthcare officials to reconsider the distribution of these injections without stringent guidelines, especially as GPS face time constraints. Consequently, SHEMD has made blood tests a compulsory step in their program prior to prescribing this groundbreaking injection. Recently, the UK medicines regulator initiated an investigation into the safety of these weight loss injections after numerous users developed pancreatitis, resulting in 10 fatalities. The Medicines and Healthcare Products Regulatory Agency, MHRA, reported receiving over 560 accounts of individuals experiencing pancreatic inflammation after using the so-called GLP-1 injections since their introduction. The MHRA is urging users who are hospitalized due to pancreatitis to report this side effect to the authorities via the regulator's Yellow Card scheme. Healthcare professionals can also submit reports on behalf of their patients. This process involves providing additional information and submitting a saliva sample, which will be analyzed to determine if certain individuals are at a higher risk of acute pancreatitis due to their genetic makeup. Researchers are optimistic that this will eventually allow doctors to utilize rapid genetic screening tests before prescribing medications, enhancing patient safety. Side effects remain a significant challenge for the NHS, with studies indicating that they account for 1 in 6 hospital admissions. The primary symptom of pancreatitis is intense abdominal pain that radiates to the back and persists. Anyone experiencing this should seek immediate medical attention. Dr. Alison Cave, the Chief Safety Officer at the MHRA, stated, "Evidence suggests that nearly a third of medication side effects could be prevented through the implementation of genetic testing." It is estimated that adverse drug reactions could cost the NHS over £2.2 billion annually in hospital stays alone. These popular injections have also been recognized for their ability to lower blood sugar levels in individuals with type 2 diabetes. However, Ms. Joy cautioned that they are not a cure-all and can lead to various serious side effects. Recent estimates indicate that approximately 1.5 million people in the UK are using weight loss injections, many of which are purchased privately due to NHS rationing. The majority of side effects associated with these injections are gastrointestinal, including nausea, constipation, and diarrhea. However, Ms. Joy warned that Mounjaro can also lead to severe dehydration, particularly in individuals with diabetes. This condition typically results in headaches and dizziness, but if not addressed promptly, it can escalate to seizures, kidney failure, or even be fatal. There have been additional reactions and fatalities linked to other side effects following the use of GLP-1 medications. The MHRA emphasizes that it has not been definitively established that the injections cause these illnesses, but patients have reported them as side effects. Professor Matt Brown, the Chief Scientific Officer of Genomics England, remarked, "GLP-1 medications like Ozempic and Wegovy have been in the spotlight, but like all medications, there's a risk of serious side effects. We believe there's significant potential to reduce these risks, as many adverse reactions may have a genetic basis." This next phase of our collaboration with the MHRA will generate data and evidence for safer and more effective treatments through more personalized prescription approaches, supporting a transition towards a healthcare system that emphasizes prevention.